Hello, everyone. We are the Affirmative team for vitamin C and its ability to treat cancer. My name is Jake.
Hi, I'm Anna.
And I'm Joya.
According to the National Cancer Institute, approximately 7% of the US population has low enough levels of vitamin C to be considered scurvy. Even with the abundance of vitamin C sources available, there are large numbers of people still dealing with deficiency. The dietary guidelines for Americans identified vitamin C to be an underconsumed vitamin. With vitamin C status often being diminished in cancer patients, it is a clear point of interest in recent years. IV vitamin C therapy has been shown to be an effective cancer treatment alone and in conjunction with other therapies and medications. Our debate will present the data necessary to support this claim. The relationship between vitamin C and cancer has been studied for many years, with the antioxidant effects of vitamin C being well known. The interest in vitamin C in cancer treatment is high. It has been shown that high-dose vitamin C in conjunction with other therapies has actually inhibited tumor growth in many types of cancer, including liver, ovarian, and mesothelioma. Not only has the decrease in tumor growth been well documented, but the effect vitamin C can have on the alleviation of symptoms associated with cancer treatment is also well noted. Vitamin C has been shown to decrease loss of appetite, nausea, and vomiting in oncology patients. With vitamin C providing an alleviation in symptoms, one could assume the quality of life would increase greatly as well. With vitamin C being shown to both reduce the size of tumors and alleviate symptoms associated with treatment, it is necessary to consider vitamin C as an option to aid in the conventional treatment process.
A study from the NHA-NES in 2012 reported that although vitamin C prevalence has significantly improved, there is a 40% chance of deficiency in Americans. Another study 2 years ago concluded that IV vitamin C favorably affects oncologic parameters such as inflammation, fatigue, and quality of life. This study included uncontrolled, controlled, and non-randomized studies. IV vitamin C is used to diminish inflammation and antioxidant deficiency in cancer patients. It functions to decrease free radical activity and treat inflammation by restoring oxidation of antioxidants. Vitamin C is strictly controlled by the kidneys, therefore tolerable upper intake levels are not likely. Although some may argue that the side effects of vitamin C may occur, research suggests chances of vitamin C were significantly higher in 10,698 adult participants taking supplements than in non-users. Only 5% of these levels exceeded the UL. Lastly, a 2018 review in the Trend Cell Biology journal suggested that IV vitamin C prevents damage that leads to cancer because it functions to repair diseased tissue, reprogram cells, mimics DNA damage, and decreases inflammation.
Not only does vitamin C act as an antioxidant, but high levels of intravenous infusions of ascorbic acid act as a pro-oxidant by generating hydrogen peroxide. Hydrogen peroxide is a cytotoxic agent that can cause cellular and DNA damage through oxidative stress. Tumor cells lack catalase, an enzyme that converts hydrogen peroxide into oxygen and water. When exposed to high levels of hydrogen peroxide, cancer cells are susceptible to damage due to the lack of catalase enzyme. In 2013, a phase 1 clinical trial, 9 patients with metastatic pancreatic cancer received up to 125 grams of intravenous ascorbic acid twice a week, concurrently with the chemotherapy medication gemcitabine for 6 months. The results of the study indicated a decrease in metastasis of pancreatic cells and prolonged survival. The average survival rate among the participants was an average of 14 months compared to an average of 6 months commonly seen for people with this stage and type of cancer. The researchers attribute these results to the high dosage of IV vitamin C that selectively targeted the pancreatic cancer cells via the hydrogen peroxide mechanism. In 2018, a retrospective cohort study, 613 participants with hepatocellular carcinoma received a curative liver resection. In vivo and in vitro experiments were able to further demonstrate a 50% decrease in cell survival of liver cancer cells in response to the high levels of vitamin C that were administered. These studies demonstrate that high levels of IV vitamin C can selectively inhibit metastasis of cancer cells through the generation of hydrogen peroxide. In conclusion, we believe intravenous vitamin C can treat cancer either alone or in combination with other treatments by alleviating symptoms, reducing inflammation, increasing antioxidant levels, and pro-oxidant activity.